Today what I want to cover is an often overlooked opportunity for you to communicate one-on-one, clinician to clinician, with your referral sources, or at least the doctors that you're sending the patient's note to if you're using direct access in the given state that you're in. So this is a quick easy sample of an outline of a progress report that we send out. You can also do the same thing on an initial eval or discharge report as well, and it doesn't matter whether you're still using paper in your reports or you're using MRI or EMR. You should be able to do this both ways. But at the bottom, right before your signature, at least we have a little section that says comment, and this is invaluable. And I picked this up from Dan Neff. I had done it for years and just really didn't realize what I was doing and the value that it had in it, but he really pointed it out to me because he asked his referral sources, like, what's the most helpful thing in the report? And guess what they said? The comment section. Like, they scan at the top when they receive the report and they go right to the comments section. So what do you write there? And this is where you can really get some mileage out of that area, because doctors aren't going to read every single range of motion or every pain level score that you write down or every function and be able to recall exactly where they were at before. Even if you provide it, it's just a lot of numbers to them. They're not going to be able to remember all the numbers of all their patients and know what that means. So for us, we'll say the same things over and over, which can be packaged into about 24 different things that we typically say, but we'll say something like this. So if the patient's doing well, Mary is doing well and should have a good, if it's a surgical outcome, so post-op, so good surgical outcome or good outcome in physical therapy. Her range of motion has doubled in the last 4 weeks, or whatever that is. It could be strength, could be her pain has decreased, and she's able to return back to the gym or back to work, or whatever the positive win there is that she's experiencing. I'm going to pick out 1 or 2 of those and highlight that in the comment section. Could be something as simple as function is improving, but long-term goals are not met. She'll benefit from additional PT. Even though you probably have that up in your assessment section, it's likely going to be more beneficial for you to just call it out again in the comments section. And the most important thing of all, aside from if there's an emergency, so patient likely has patient has red flags and requires more diagnostic testing, you can write that in there, and I always just put asterisks everywhere to call attention to it for the physician. But if that is not the case, the most valuable thing that you can have in there is thank you for referring Mrs. Jones. Thank you for referring this patient. And especially if the doctor does a nice job of referring, so they talked you up before they referred, I'll always note that. So when Mary came in today, she said that you spoke highly of us. I want you to know I really appreciate that. Thank you for your referral. And then I sign off at the end there. So it's a nice little place where you can acknowledge your referral sources for referring.